is Dr. Kate Eckert. I'm a chiropractor and I have been doing pelvic floor work and women's health since 2015. I first started with the ICPA. I learned Webster technique, which is a technique that we use with pregnant women for pelvic balancing, helping with easier birth, easier pregnancy, less symptoms of musculoskeletal pain, those sorts of things. Then I got into BirthFit, and that is a great system for maintaining pelvic floor integrity throughout pregnancy and after, helping you rehab after a birth delivery, whether it be C-section or vaginal. They draw from a lot of principles of dynamic neuromuscular stabilization, and then I got into that route. So I've done a ton of pelvic floor training in the past more than a decade. And then once we had some restrictions to how much exercises we could do, exercise that we could do with patients because of insurance cuts, we shifted to using our regenerative therapies for pelvic floor rehab. So I refer out now for patients that I think need in-person exercise and internal work. And I also have a whole library of YouTube exercises for my patients to do at home as well. So if I think you need more than the at-home exercises that we provide, we refer out for in-person exercise and internal work. And then we do restorative, regenerative therapies in the office. And we're going to give you a little bit of an insight into what that looks like. So we're trying to help people reclaim their pelvic health and give them relief of symptoms that they thought might not have been a possibility. A lot of times I ask patients in their intake if they have a pelvic floor issue, and they say no. They often say no. And then I ask if they can jump on a trampoline, and then they laugh, and then they say that they cannot. So if you cannot jump on a trampoline without leaking, you do have a pelvic floor issue. And if it's not that bad, it can definitely, in your mind, you can definitely improve it. And that is going to not only improve your ability to jump on a trampoline, it's going to improve your low back pain, your hip pain, and a whole host of other things. So our main office is in Oil City, and our satellite office where we just do shockwave and laser therapy is in Grove City, Pennsylvania. So let me move my whole thing over here. Urinary leakage is the thing that people usually think of when they think of pelvic floor issues. Leakage, urgency, incontinence. You can also have fecal leakage or incontinence. It is not talked about often, but it is a symptom of pelvic floor issues, and it is so life-changing in a negative way. I have had patients come in with that, and it can really seclude you and not make you able to go out into the public like you want to. Painful intercourse is another one, chronic pelvic discomfort, low back or hip pain. I often see patients in the office that are not getting better from traditional care for their low back and hip pain, and there's also often a tie to their pelvic floor, and that's the missing link. Frequent tension headaches or migraines. Now, this seems totally unrelated to the pelvic floor, and that couldn't be further from the truth. And the next one, the TMJ pain or teeth clenching, ties into the headaches, and the clenching of the jaw syncs up with the clenching in your pelvic floor. So those are tied together, and they will affect each other. So it's really important to try to fix both at the same time, or you're going to be chasing your tail playing whack-a-mole, fixing your pelvic floor issue, then that's feeling better, and then you got to fix the jaw issue, and it goes back and forth, and we really need to focus on both to get complete relief. Chronic stress and muscle tension. One thing that is not on here that should be is plantar fasciitis or foot pain, and it can be cyclical. It can come and go, just like that whack-a-mole that I was talking about before. You might fix the plantar fasciitis, and then the TMJ comes back and the headaches, or vice versa. Now, how are all these connected? These areas may all be connected not just through that retained infant reflex of the clenching of the jaw syncing up with the pelvic floor issue, or the glute clenching, pelvic floor clenching. It's also connected through your body's deep front line. There we go. So this is a picture of the deep front line. The deep front line is based off of Tom Meyer's work, and it's called Anatomy Trains. And it links different lines throughout your body that are fascially connected. So all the muscles in blue here are the muscles that link up with this deep front line in your body. So we've got the temporalis on the sides of the head that engages when you clench your teeth, the masseter that engages when you clench your teeth, the deep neck musculature. If you take your throat off, it's deep to that. We've got the diaphragm, which is your breathing muscle right here, attaching all to the ribs, but then it anchors with these little tails onto the spine. Then we've got the psoas and the iliacus, and those come together, wrap over the front of your hip joint and attach onto the leg. So it takes a very windy path to get to where it attaches. It's often complicated with chronic sitting, with babies sitting down on there, putting a lot of pressure on there, and it ties into the fascia of the pelvic floor, into the inner thigh, and then this blue thing down here is your tibialis posterior, and that connects into the arch of the foot. So all very, very important in connecting those stress spots. Really what I see this in people that are stressed. Lots of times I ask people if they're stressed, they tell me they're not. And then they tell me the things they have going on in their life, and I know that they are just compartmentalizing. And stress doesn't have to be somebody just died or you're having something traumatic happening. It can be being too busy. It can be being on screens too long. It's stressful to your nervous system. It puts you in fight or flight mode, and you're not getting into that rest and restore mode that we need to downregulate our nervous system. The diaphragm is an interesting connection into this line because the vagus nerves run through the diaphragm. So proper use of the diaphragm, big, deep 360-degree breathing is going to help rub on the vagus nerves, stimulate them, and give you that down regulation of the nervous system that you need to switch from fight or flight to rest and restore. Oops, wrong direction. So we've got this stress response. We are stressed or just have too much going on, not enough rest. We clench our jaw, we get this neck tension, shallow breathing where we're breathing at the upper part of our neck rather than using our rib cage. It makes our diaphragm dysfunctional. We don't get that vagus nerve stimulation that we're looking for. We clench our glutes, we do toe curling. It gives us pelvic floor dysfunction, and we get into chronic fight or flight. One thing I want to point out here about the neck tension is when you get tension in through the neck, it will cramp these trunks that we have in the front of our neck to move our lymph system. So our lymph fluid goes through two trunks that are big in the front of the neck. So if you have a ton of tension in your scalenes and your SEMs, it is going to impede the flow of the lymph fluid. Now, why do we care if you have bad lymph flow? We care because it will leave you super inflamed. An inflamed body is just ripe for injury. It's setting you up to fail. So we want to have really good lymph flow. So it's tension at the neck that's restricting those main trunks that your lymph fluid cycles through. And then also the dysfunctional diaphragm plays a role in that inflammation too. So if your diaphragm is not contracting, it's not going to be pushing the lymph fluid around. So a lot of lymph fluid sits in your abdomen. The diaphragm at rest sits up like a tent. And then when you inhale, it should contract and push everything down a few centimeters, and it pushes the lymph fluid around and lets it filter through the body. So if you're not using your diaphragm, you are not pushing that around. So stress, people think pain from stress is just stress in your head or pain in your head. It is not. Stress manifests physically. We've got jaw clenching, shallow breathing, and glute clenching all happening with this stress response. Jaw clenching giving you the TMJ pain, headaches, neck tension, shallow breathing giving you poor vagus nerve stimulation, stagnant lymph, chronic inflammation, and then we have glute clenching that's giving you pelvic floor tension, urinary issues, painful intercourse. We have to fix all of them, or we're going to have issues in a variety of spots. So we use regenerative therapies in the office, and why we love these is because there are minimal side effects. It treats the root cause, stimulates true healing through cell regeneration, and addresses the full fascial chain. We can treat the jaw clenching, the pelvic floor issue, and the feet all together, and it gives you that full, complete approach rather than the whack-a-mole approach. Another one of the therapies we use can also be started immediately postpartum. So a lot of times with pelvic floor therapy, you're not able to start until at least 6 weeks after. With laser, we are able to start your therapy the day of. So if you had a terrible tear in your perineum, we would start lasering that as soon as you can get in to help reduce scar tissue from laying down as it heals back together. Lasering as soon as you have a surgery, like a C-section or the perineal tear, helps reduce the scar tissue that forms when you're healing. It helps speed up the healing process, and it helps reduce the pain. So you have a 2nd-degree tear, a 3rd-degree tear, a 4th-degree tear, you're having fecal incontinence. This is going to help with your pain immediately, and it's going to help you have better healing overall. It's kind of a no-brainer if you have a lot of painful tearing post delivery. And also with the C-section, I was lucky enough to not have a C-section with either of my kids, but if I did, I would have lasered it immediately, because that cutting through all the abdominal layers is going to give you, or it has the potential to give you, a lot of issues with your abs. But the abs affect so many different things. It affects how our low back functions, it affects our hip mechanics, and so not addressing the integrity of our abs right away is something that I think we fall short on as a society. So the regenerative toolbox that we use focused shockwave, class 4 laser with 4 different wavelengths. So we have a 660 diode, an 810, 980, and 1064. We have PEMF of a higher intensity, which is a PMST machine, and we have red light therapy panels. So focused shockwave. Shockwave does 3 things. It breaks down calcification, stimulates cell regeneration, and increases blood flow. The breakdown of calcification helps us work through old scar tissue. So if you had an old C-section scar that was not allowing your abs to function appropriately, we would use shockwave to break down that scar tissue and give you less numbness in the area, help with the function of the abdominal muscles. It would help with the shelf thing that happens when it adheres to different layers underneath. It's not just one layer adhered together. With a C-section, it's multiple layers of the tissue being adhered to each other. So you kind of have to peel back the layers of the onion. With our shockwave, each pad is a different depth into the tissue. So we would use the surface layer and 1/2 centimeter, and we would gauge on how you respond to which pads we would use. And we're targeting breakdown of that scar tissue at different layers of treatment. It helps increase blood flow. That helps with healing. It helps with healing the nerves. The cell regeneration is really the magical part of the shockwave therapy. So cell regeneration totally makes something new, similar to stem cell shots or PRP shots. We use this therapy again on the C-section scar, but we're also utilizing it on the nerves that innervate the pelvic floor. So the nerves that innervate your reproductive organs and your pelvic floor are the pudendal nerve. So we've got this diagram here. So we're looking at the pudendal nerve right here. This is your tailbone. These little holes on the back of it are the nerve roots. So you've got these nerve roots at S2, 3, and 4. They come out, they form a nerve, and that is not going to the pelvic floor itself. It's going to more sensory stuff. But on the other side of the tailbone, on the inside, you've got S2, 3, and 4 anterior nerve roots, and they form this pudendal nerve. So they're coming out on the inside, they're joining together to make the pudendal nerve. They come down this canal called Alcock's Canal. They slide under this dense piece of fascia, or it's a ligament. So this is the bone that you sit on. So if you're sitting on your chair and the bone that you sit right on either side, this is called your ischial tuberosity. That's right here. This is your tailbone. So the pudendal nerve is going right between the coccyx and the bone you sit on. So to get to that depth, we go up to 4 centimeters deep, depending on the size of the person. And we're tracing that area, trying to help with the regeneration and improvement of how the pudendal nerve functions. This is also how we treat pudendal neuralgia, which is an extremely painful irritation of the pudendal nerve, and that's going to give you a lot of pain in the pelvic floor. It's going to feel like it's inside you as well, and we treat that same area. So we're treating the tailbone. We're treating the depth, the really deep depth for the pudendal nerve with the shockwave. And a lot of times with that comes treating the back side of the musculature that borders the pelvic floor. So we go super deep. We're hitting piriformis and obturator internus that share fascia. They come across from the top of your leg bone into your tailbone area, and it shares fascia with the pelvic floor. So we treat those structures to help with pelvic floor function with the shockwave. Shockwave is the opposite of a steroid shot. So steroid shots are meant to be really quick fix. It gives you relief right away and then it fades. This is going to take a lot longer, but it's going to give you a more permanent root-based fix. So we don't worry if we don't see any improvement for a month or so, because we are waiting for that cell regeneration to happen. And the cell regeneration takes about 2 to 3 months to work. So it's delayed gratification that can be frustrating for people, but that is how it works, and it does give you more complete work. Now, I did my training on how to use shockwave therapy for pelvic floor issues with the Herman Wallace Pelvic Rehabilitation Institute. That is a very well-respected physical therapy pelvic rehab institute where most PTs do their training for pelvic floor therapy. Now, we also use shockwave to treat the jaw. So we use the sound waves in a more superficial capacity than the pudendal nerve around the ear. We do the front of the neck, not through the throat, but on the sides here. We do where those deep muscles of the neck attach on the collarbone. And a lot of times people will draw their shoulders up to their ears, and we treat the traps and those muscles as well. Same thing with the foot. We're treating the plantar fascia, the heel, into the calf a little bit. Those are all needed to give you that well-rounded approach. The interesting thing with shockwave is that for those areas, we feel it where the issue is. Now, for scar tissue, like a C-section scar, you might not feel that because of the numbness that happens with surgery. But for the other areas, we are looking for these achy spots, and that is really diagnostic and helpful for us, and that tells us where you're having the issue at. Healthy tissue, you do not feel sound waves moving through it. And then tissue with calcification in it will feel achy to the patient. So that achy, it's a lot of back and forth between the patient and the provider as to where these spots are, where the achiness is at. All right, now we have class 4 laser. So like I had stated before, we use it for nerve pain, reset neuromuscular control, increase blood flow in a different way, reduced inflammation, and speeding the healing process. So we definitely recommend just laser right after surgery or tearing. I did my training for utilizing laser for this specific instance with Isa Herrera, who's a physical therapist for the pelvic floor. There are a lot of transverse abdominis referral spots that we treat to help with pelvic floor pain, tension, and function. We also use the laser to speed up the healing post C-section and post tearing. And then for the headaches and TMJ, we use the laser on the temporalis, where we don't typically do shockwave therapy. PEMF therapy. This is our newest therapy in the office. We just got it. What we have is PMST. It's 40% stronger than PEMF. It is going to get deep enough to treat the actual pelvic floor musculature, and it promotes engagement and relaxation. A lot of times pelvic floor dysfunction comes from being too weak, but also it can come from being too tight. So doing the traditional Kegels and that kind of thing might make you worse. PEMST helps improve neuromuscular control, giving you better coordination and tone. It pairs perfectly with pelvic floor exercises. It increases blood flow to the pelvic tissues, and it supports connective tissue healing. So if we're looking at this from the ground up, we're looking at the anal sphincter, the vaginal opening, the urethral opening, and you can see the different parts of the pelvic floor musculature. So when we're doing shockwave, here's the tailbone. We're going super deep, getting into coccygeus. We're treating piriformis, obturator internus, and those are all connecting in to the pelvic floor musculature. The PMST therapy, we will be utilizing you sitting on the attachment for the pelvic floor therapy so that the therapy is directed straight up into your pelvic floor musculature. This is not a painful treatment. You barely feel much of anything, and it's only takes about 20 minutes to complete the treatment. Red light therapy helps to enhance cellular energy and repair, improve circulation and detoxification, reduce inflammation, tissue recovery and regeneration, relaxation, stress reduction. It's a very relaxing therapy to do. We have a full body panel that has really good irradiance. That's how you measure how good the product you are using, how many wavelengths and the irradiance. So the panels that we utilize are full body. They have 8 different wavelengths, and they have a very high irradiance for maximum benefit. It helps with that overall stress and inflammation that really complicates us getting full improvement. So one of the things I've seen online a bunch are these red light underwear. Now, I have this picture, and you can see how this is very narrow at the crotch area, basically. There's lots of diodes on glutes and in the front on the abdomen. The wavelengths that these particular underwear use are 660 nanometer and 850 nanometer wavelengths. It's low wattage. That's what makes them wearable, so that you're not needing to move it like a class 4 laser. Now, there's only like 1 or 2 diodes right on the crotch of the underwear. So there's barely any therapeutic direction of it going towards your crotch, your pelvic floor. So you're thinking in your mind, these should work for me by targeting my pelvic floor musculature. But these low wattage and wavelengths cannot reach your pelvic floor musculature. That would be futile to have a bunch of diodes going aimed up to that area. The reason why these work is because the diodes on the back side of the underwear are aimed at your muscles that share fascia with the pelvic floor and your pudendal nerve. The front of it is aimed at the transverse abdominis musculature that shares fascia with the pelvic floor. So it makes sense to me why these work, but they do not have any diodes targeting what you would think that they should target. And that's kind of how we learned to do our laser protocols. Now, our laser is different because it adds in 2 different wavelengths. We still have the 660 nanometer, that's the red part that shows us where we're aiming it, but it adds the 980 and the 1064. It's a higher therapeutic wattage and it's precise and more targeted. So while you would have to wear these underwear all the time, you could do our laser and do a shorter amount of treatment time, less treatments type of thing to get the same results. So this approach works because we're treating the root cause, not just the symptoms. We have seen this deep front line in hundreds and hundreds of patients, not just females. This also works with men as well. Men can have pelvic floor issues. They have the same musculature and their pudendal nerve innervates their pelvic floor and their reproductive organs. There's a lot of parallels between male reproductive organs and female. This helps to stimulate regenerative healing instead of just that whack-a-mole approach. We love it because there's minimal side effects and you don't need as much medication. I've seen patients since 2008, and I've seen people abuse NSAIDs because of chronic pain all the time. And just because it is an over-the-counter thing, especially with headaches, it doesn't mean that it's good for your body. So we're trying to give people a less even over-the-counter medication option. And then we're able to start immediately postpartum, no 6-week wait, and then the reduced stress response and nervous system dysregulation. This is quite an investment for somebody to try, but we do think it can be life-changing in helping you enjoy life better, be able to function with your family and your kids. Unfortunately, these therapies are not covered by insurance. The machines and equipment are quite expensive. Just for the machines that you would use in these packages, the machinery that you're using is over $100,000 of equipment that you'll have to use to get these treatments. So there is a reason why that they're so expensive, and we do like to keep up with the most up-to-date and newest research. So we are continually going to seminars, fine-tuning our approaches, and improving. We are doing so much better work than we were when we started in 2023 versus 2024 versus 2025. We have 2 new seminars to attend in 2026. We're excited to see what they provide us for new things on the horizon. So there's a reason for the cost. We do think that it gives our patients truly magical results. And if you have any questions on our therapies or what we do in the office, feel free to reach out. You can email me or give the office a call, and if they can't answer your questions, they will pass it on to me. All right, have a good one.